Hey guys, it's Dr. James Kent. This week's video is going to be talking about gout. We actually have a gout patient where I removed a small gouty tophi in the hallux interphalangeal joint. So what that would be on the hallux, it would be this joint right here, and he had a small gouty tophi. It's really not that small. It was probably about 3/4 of an inch by 3/4 of an inch. But what gout is a type of arthritic disease, and what happens is you develop a little bit of tophi inside of a joint. Now, the most common is the big toe joint, and the reason why is because the temperature of the big toe joint is usually the coldest in the body around the toe. So what happens is you develop a cottage cheese-like material around the joint. You see it right in here in this great toe joint. This is in the hallux interphalangeal joint. This is where I removed it. And then you can also have it behind the Achilles tendon. You can actually have it in the ankle joint. I see this all the time where people have it in what we call the mid-tarsal joint or the midfoot. And it's just a small buildup of uric acid crystals, and it can get larger in time. So if people want to know, okay, what is gout on a microscopic level, if you look at same thing right here, you have a gouty tophi here, and what caused the gout? Well, if you look at this small little insert right here on this diagram, what it is a buildup of uric acid crystals. On a microscope, they look like tiny little pine needles. You know, here in East Texas we have a lot of pine trees, and everybody around here knows what a pine needle is, but if you look at this on a microscopic level, they look like small pine needles on a microscope. But what we did today is we actually removed some gouty tophi. I actually made an incision on top of the foot and actually removed some of that gouty tophi. And you actually have to use a curette, kind of like you're scooping out ice cream right in this area, but you have to completely remove that tophi. Then I actually removed it, and believe it or not, we're seeing him post-operatively about a month now. He's healing great. So hope you liked the video, but this is actually a gouty tophi removal. Thanks, guys.